Hi, my name is Trang Nguyen,
And I'm Allison Lopez
and this is a call to action.
to antibiotic resistance in infant gut microbiome.
Um, Next, this is our purpose slide. Over the years, antibiotics resistance has always been a public health concern. However, recently it has been discovered an increase in antibiotic resistance among infants. Antibiotic resistance can lead to a further complication in their adult life. Antibiotics resistance is when bacteria can withstand and defend themselves from the drugs given to kill them. In a way, bacteria can have immunity against specific medication. Antibiotics resistance can be caused by the misuse of antibiotics prescribed or through horizontal and vertical gene transfer. Vertical gene transfer is when genetic materials are transferred from parents to offspring. Horizontal gene transfer is when genetic materials are transferred between donor and recipients that are not related. One main disadvantage of antibiotic resistance is difficulty treating the sickness because most drugs will not work, causing the prolonged illness that will eventually lead to death. Next. So this picture is an overview of the cases of infants being, I guess, not immune, but getting antibiotic resistance and what scientists have discovered so far to kind of treat that. Next.
So this is the general outcome. So children are born with sterile gastrointestinal tract, but become essential reservoirs of the resistant organism in their infancy. Unnecessary antibiotics subject each infant to possible harmful consequences, including diarrhea, vomiting, rashes, and allergic reactions. The overuse of antibiotics often raises the likelihood of exposure to antibiotic resistance. This is because widely used antibiotics are unsuccessful against specific pathogens, rendering such diseases are challenging and sometimes impossible to treat. Also, the costs of treatment will also affect the infant's family as there are extended hospitalizations. Other factors to consider would be that there would be a need for more costly and intensive medication.
News research for scientific articles. Due to the antibiotic resistance being a public health concern and a more common occurrence, multiple studies have been done to discover the root of antibiotic resistance. In 2017, a study done by Yassor and his colleague discovered a strain of B. fragilis and E. rectal were not found in positive antibiotic resistance children, but only in negative antibiotic resistance children. Antibiotic resistance has also discovered to decrease intestinal microbiome diversity when there is an increase of antibiotics during the first few days after the baby was born, and this can cause the gut microbiome to be imbalanced, leading to other problems such as difficulty absorbing nutrients and regulating blood sugar. Not only does antibiotics resistance come from a misuse of antibiotics during a newborn phase, but also it was discovered that antibiotics resistance can come from the mother's breast milk. The study shows that some form of antibiotic resistance are found in gut microbes due to the exposure of maternal and environmental microbes during the early stages. With an increase of concerns for antibiotic resistance, data showed that there was a decrease about 33% in prescribing antibiotics for young children between 1995 through 2006. Next. Um, so this picture shows how antibiotics resistance kind of develop in the body and kind of take over. Next. And this is how antibiotic resistance spread. It can be from the food that you consume or in the hospital when you're like birthed and all that. Next.
So this is the new article section. One of the following guidelines for the do's and don'ts for infant medication safety. So we can begin with the don'ts. So don't use kitchen spoons to measure child's medicine. Don't use medication after expiration date. It expires from 10 to 14 days for antibiotics. Do not give unprescribed medication and do not share your antibiotics with another. Preventing these measures, the parent will help and protect their baby. The overall outcome is to have the child healthy and unharmed. It is better to have a child at home rather than to be stuck in the hospital. The latest figures indicate that more than 200,000 newborns, die every year from infections that do not lead to drug availability. So why would someone want to abuse the medication intake for the child? Well, so the next thing we'll talk about the do's. So do check with the caregiver and ask if the medication is necessary. Don't overuse or try to provide a different type of medication for your child. Always keep it out of reach for the children. If finish all the antibiotics even if the child presents signs of wellness. You always want to finish the medication even though the child may be unharmed or well, because there could be more further resistance with the genes. Also measure the right dose using a syringe, a cup, measuring cup. You can also ask one from the pharmacy, and also dispose the leftover medication. It is in the child's best interest to act accordingly to prevent any mishaps. Otherwise, doctors will find it almost impossible to find other drugs to destroy the infection. The use of antibiotics make premature and low birth babies vulnerable to bacterial infections such as E. coli, pneumonia, and other pathogens. However, there is hope to help with these infants. Many researchers, such as David Califf, have been working hard to find a new strain, the Bifidobacterium unique strain B, infant, infant, infantis EBC001, has helped decrease the antibiotic resistant genes by 90%, including removing antibiotic resistant genes in the child's gut microbiome, such as the E. coli, Clostridium, and Staphylococcus. The most critical move is to avoid transmission of infections, such as antibiotics do not have to be used in the first place. You might want to avoid using it, so better to treat the baby now sooner than later with antibiotics. So this is the antibiotics poster, kind of call to action to the parents. It has been an ongoing fight against antibiotic resistant organisms. These superbugs have grown more robust and more resistant to antibiotics, posing a threat to many infants. Gut microbiome diversity will significantly decrease, which has a long-term effect on the child as it grows. They will be more susceptible to infections, not to mention prolonged illnesses. To the all expecting parents and parents who plan to conceive must prioritize both the child and the mother's health. Being informed allows the couples to have an awareness about the risk, having kids, and being careful with prenatal and pregnancy nutrition. There are many factors to also look out for, because not only should you want to focus on their health, but also consider the financial situation they will be in or are in.
And that's our works cited page. How do I stop this?